So welcome. This is a presentation on the Count the Kicks public health campaign to prevent stillbirth in partnership with the wonderful state department there in Florida. The Florida Department of Health is a wonderful partner, and we are thrilled to be here. Just a few housekeeping items. This webinar is being recorded. And we are going to be turning off. I'm going to turn off my camera during the presentation just to help with the broadband issues and make sure that our presentation runs smoothly and our videos run smoothly. Feel welcome and free to put questions in the chat. I will answer those at the end of the presentation. And I would love to make sure that everything is crystal clear so that you are ready to use this information in your state. And we will be sending out a recording and the PowerPoint slides. So if you're a note taker, great. But if you don't have a chance to get all the information I'm sharing, I will be sending a PDF of this PowerPoint along with a recording and a survey for you after this. So just know that that is coming. So I think it's time for us to get started. I'm going to go ahead and turn my camera off. And let's talk about Count the Kicks and how to save babies in Florida. So my name is Jen Rowry, and I am the Director of Advocacy and Engagement for Healthy Birthday, Inc., which is the nonprofit that runs the public health campaign, Count the Kicks. My nonprofit is located in Iowa. As I mentioned, for some of you that signed on later, you might have missed that. That is where our campaign was born, but we are now a national campaign and really thrilled to be in the state of Iowa saving babies with you. As I've been with the organization for 4 years, and as the Director of Advocacy and Engagement, my role is to do presentations, to build partnerships, and to really educate not just about stillbirth prevention, but the prevalence of stillbirth in this country and the tragedy that is, but also the fact that it can be preventable, which is why we're all here today. No doubt every single one of us cares about birth outcomes and wants to see healthy moms and healthy babies. So thank you so much for joining us. I also do some work with legislation, and we're really excited to see on the federal level stillbirth starting to have a voice. And so if you have not seen some of those actions, please do pay attention. We need more awareness in this country on stillbirth, as I mentioned. My email is there. You are always welcome to be in contact with me with any questions, support, or ideas that you may have. So we're going to go ahead and start with a quick video. One of the most powerful and effective ways we have found to educate expectant parents is when expectant parents share with each other. Through the testimonies of those whose children were saved from counting and tracking their fetal movements, we can see the ripple effect of how that impacts the actions of others. And so today we're starting with a Good Morning America clip from 2017, where baby Ruby was saved by her mom, Emily Ecoff. And I just want you to pay attention a little bit to Count the Kick's role in this story, but also to Emily's description of what changed and why she spoke up and how important that was in getting Ruby here safely. So let's watch.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
We're going to turn now.
So who doesn't love a good feel-good story? So Ruby is now an active, healthy 4.5-year-old that I look forward to seeing in a little over a month at an annual event. And I love that Emily's story highlights movement and the change in that movement. So let's talk about Count the Kicks. What is it? Count the Kicks is an evidence-based stillbirth prevention public health campaign, and it is an early warning system for expectant parents. It educates birthing people on the importance of tracking fetal movement, either using our free Count the Kicks app or our free downloadable paper kick counting charts. It empowers expectant parents to speak up to providers if there is a concern and gives them that voice in their care. We are looking forward to saving 1 in 3 at-risk babies across this country in the state of Florida, just as we have seen in the state of Iowa. So before we get too far, I think it's important to level the playing ground and make sure that we, by definition, know what stillbirth is and the difference between stillbirth, miscarriage, and infant mortality. So a miscarriage is the loss of a baby prior to that 21st week. So 20 weeks and earlier is the loss of a baby. Stillbirth is that 20-week to the end of pregnancy. Anytime before baby is born, if baby passes away, that is considered a stillbirth. There are definitions or terms for early stillbirth, late, and term stillbirth. And if you look at that timing, we really are talking a lot about preventing those late and term stillbirths with the Count the Kicks campaign. Although some moms will count sooner and earlier if they can feel baby and baby has developed a pattern. We'll talk more about that in a little while. On average in this country, and I think this is a really important thing to understand, we are losing 23,000 plus babies every year on average in the United States. But that's not something that people are talking about. That's actually more than we're losing to infant mortality, which we lose way too many babies to infant mortality as well. But we need to be talking about stillbirth. We need to be finding solutions, and Count the Kicks believes that we can be part of that solution for you in the state of Florida. So infant mortality, real quick, is a baby that takes a breath in this world and passes between that first breath and their first birthday. All of our slides have, all the slides that talk about research data, give terminology, have links to research that we are using to share. If you're one of those research people, please feel free to learn more. There's a ton of research on our website as well. So why do babies die before they're born? And that stillbirth definition, we said that's 20 weeks to whenever a baby is born, if they pass away. And so these are reasons. I'm not going to spend a lot of time talking about that. Unfortunately, one thing I want you to know is that because of the lack of research in this country and the time and focus on this silent epidemic in our country, there is not a reason for a lot of stillbirths. A lot of parents never know why their baby stopped breathing or what went wrong. But if they can determine that, these are some of the top reasons that we lose babies. Problems with the placenta, pregnancy and labor complications, birth defects, genetic defects, infection, problems with the umbilical cord, and medical complications in the mother. We know that baby's health and mom's health are obviously intrinsically tied together. So if mom has a health issue, obviously that can impact baby and vice versa. When I talk about this silent epidemic and we want to bring stillbirth out of the shadows, I think that this is really one way for you to understand by numbers, but we also know that we have to talk about this in a human way. But I want to talk about the stats for right now. National data indicates that every 1 in 169 pregnancies ends in stillbirth. That's way more prevalent than a lot of people think. We are no longer talking about something that happened to our grandparents' generations or the generations before us. For an industrial nation, we are actually falling behind in one of the worst for the stillbirth rates that we are incurring. And so that's why we're talking about it. And what's more horrifying is when you look at those disparities, there are vast racial disparities that persist among stillbirth. For Black expectant parents, the number is 1 in 96 pregnancies ending in stillbirth. For Hispanics, 1 in 199. Indigenous, 1 in 138. White, 1 in 204. Asian Pacific Islanders, 1 in 233. As we mentioned, it's just as prevalent, actually more prevalent than infant mortality, it being stillbirth. And families are 10 times more likely to lose a baby to stillbirth than SIDS. We are not downplaying the importance of reducing SIDS numbers for saving babies after they're born. We're just trying to highlight here that stillbirth needs to be a part of the conversation, and it is something that we can do something about. So thank you for joining us today to learn about that. Specifically in your state, Florida has a rate of 6.8 per 1,000 births. So almost 7 babies per 1,000 are lost to stillbirth. That is pretty significantly higher than the national average, which is 5.95 per 1,000 births. You can see here those rates for Black, Hispanic, and Hispanic Americans are higher, especially in your state, noticing that rate for Black expectant parents being 10.3. That means in your state, approximately 1,445 babies are lost each year. Our goal is to save 481 of those, and that's what we would do if we could save 1 in 3 at-risk babies in Florida with Count the Kicks, just like we're seeing in Iowa. Speaking of Iowa, here is a chart to show that in 2021, preliminary the Iowa stillbirth rate is 4.1 fetal deaths per 1,000 births. This is the second lowest Iowa stillbirth rate since 2003. In 2018, the lowest rate was 3.9. You can see here that this 2008 is the inception of Count the Kicks in our state. And then the trend line that shows you that continual decrease or decline. Yes, there are outlier years, especially in a low birth rate state like Iowa. We're going to see those outlier years because of things like pandemics, a syphilis outbreak, that kind of infection can impact pregnancy results. And so we will see outlier years. We will study those. We will try to learn about those, and we will try to improve upon those years as well. But the really exciting thing is that downward trend line. In Iowa, we have seen a 32% reduction since in the first 10 years of the Count the Kicks campaign in our state. We have also experienced an almost 39% reduction in the Black stillbirth rate in our state in the first 5 years of the campaign. And so we would love to see that replicated across the country and bring home 7,500 babies alive every year if we could realize that, saving 1 in 3 at-risk babies across this country. So disparities, we mentioned them, they exist. I don't think anything on this slide is going to be shocking. It should not be shocking. We know that we can do better, and we need to do better, and we should do better in this country. We know that systemic racism is a cause for some of these disparities, for a lot of these disparities. We know that racism causes toxic stress, which causes health problems that can temporarily change literally the DNA sequence in a human being, that epigenetics. We also know that toxic stress creates that predisposition to certain health conditions, and access to healthcare, socioeconomic barriers. All of these are reasons why we may see disparities in stillbirth. And these were pulled out from different research studies that have been done on the disparities in stillbirth. And so I hope you're here today to learn not only that we have these disparities, but what you can do to partner with us in the state of Florida and this country to do better. One thing I want to highlight before I leave this slide is that research shows that education is not a determining factor for stillbirth. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. We just have to do better. So we're excited that you're here. Let's talk about what we're doing as an organization. We do have an amazing health equity coordinator on staff, Ms. Stephanie Moody, who helps us from the inside out, make sure that we are addressing any internal issue we may have. We're looking at not only our outside actions, but are we being inclusive within our organization? Our board and staff is 100% anti-oppression trained and has been trained on structural racism. We've been having those conversations, learning together, doing better together. We want to improve our programming based on the lived experiences of those that we are trying to reach. So we're listening, we're learning, and then we're reaching out to great individuals, community-based organizations, healthcare workers that are doing the good work, that are already trusted within those communities that are being marginalized, and asking them to come alongside us to share Count the Kicks to help us reduce these disparities. We also try to make sure, or we do make sure, that our literature is culturally appropriate, that we provide that app in as many languages as possible. In fact, thanks to the partnership with the Florida Department of Health, we added Haitian Creole at their request. And we are thrilled to continue to add languages. Currently, there are 14 languages on that free app, and that will continue to grow. We are a research and evidence-based program, so let's talk about that. Really, the piece of research that started this. So our organization was founded by 5 women here in central Iowa, where we're located, that lost babies, 4 of them to stillbirth, 1 to infant mortality. And after their loss, they got together and they said they met each other through mutual family, friends, in their grief, and they grieved together. But in that grief, they realized that they had similarities in their stories, that they had hard questions that didn't have good answers, that really in the state of Iowa and the nation, no one was tracking stillbirth. If we don't understand the problem and why we're losing babies, we certainly can't find solutions. And so their first action actually was to pass a state stillbirth registry, the first of its kind in this country. And then after that, we followed, the nation followed with a national stillbirth registry. Unfortunately, that registry is no longer active. More research needs to be done on stillbirth. More funds need to be spent on stillbirth. Even on that chart I showed you, data is so far behind on stillbirth. So the last CDC update on national stillbirth data is 2019. And we really need that information more quickly. And so those are the reasons for the push on the federal level for legislation changes and more attention to be drawn to this important topic. Anyway, so our founders, 2 of them were at a national conference presenting actually on that registry they created in Iowa that I just mentioned. And they listened to a research study done in Norway. And that study essentially was educating a group of providers and a group of expectant parents on that conversation. We know that, and this is not up for debate, right? That we know that movement matters in pregnancy. Medical providers understand that movement matters in pregnancy, that 3rd trimester baby really, that is their voice. That is, oops, I apologize. That is how they can speak to us. And so that is why movement is so important. But moms being educated, or pregnant people being educated on tracking that movement, knowing what to do if they notice a change, how to speak up, who to speak up to, and then someone on the other side of that, right? That care team listening to that, taking it seriously, and then taking it from there, doing the testing that needs to be done, making the medical decisions that need to be made to assure that that baby and that pregnancy stay healthy and that mom stays healthy. And so this research study out of Norway showed a 30% reduction in stillbirths in Norway. And that's when those 2 founding moms said, that's it, that's what we're going to do. And that's really where the idea of Count the Kicks was born. Dr. Ruth Fretz was one from Harvard Medical School, was one of the researchers on that study. and she is continues to be a member of our medical advisory board today. And one thing that she says that I think is super interesting and important to pay attention to is she said tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. And we continue with that belief as we move through this presentation. The best, being named a best practice by AmChimp, the Association of Maternal Child Health Programs, is another place where we were put through a thorough scientific review. Our program was put through that review, and the top membership organization in this country said, absolutely, this is a best practice, that this should be implemented. We hear about movement in the CDC's Hear Her campaign. It's a top, one of the top 15 urgent warning signs for expectant parents to know, to speak up about. One barrier sometimes is that we hear, or some pushback we get, is that we don't want to see or have an influx of panicked moms coming into the labor and delivery triage or into their doctor's office or calling unnecessarily. That because their anxiety is so high, because we've talked about stillbirth, we're talking about movement, and we've created fear. Actually, this has been studied. And the result is this: one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found that this type of increase is true. Usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. There are several research articles cited on this, but specifically, we had a study done on our app users by Des Moines University and the Harkin Institute. And what that study found is that 84% of our app users actually stated feelings of bonding with baby, which is a wonderful side effect. It can really help reduce those ACEs, adverse childhood situations. Like if there's a bond between expectant parent and baby prior to birth, that is amazing. But notice this: 77% of our app users reported feeling less anxious, not more anxious. I will tell you, there's probably a subset of women who have already lost babies, are experiencing a high anxiety rainbow pregnancy, who actually would say that this number is like, those people probably are higher, like 90-some%, because they already come into that pregnancy with high anxiety. And so actually it's reducing that anxiety. It's giving mom a tool to know when to speak up. So it's helping provider. It's a free resource for everyone. Other additional benefits: reduction of preterm birth rate. We believe that Count the Kicks can be a part of that. Let me give you an example. Our own executive director was aware to track her movement. She was doing that, noticed a change in her son's movement at 30 weeks, was experiencing no other symptoms that she was aware of, called her provider. The provider asked her to come in to be seen. It was discovered at that time that she was actually in preterm labor. Her body was trying to have that baby, unbeknownst to her. So what sent her to the doctor was a concern about her baby. And that early intervention was key into getting, she was put obviously on medicines to stop that labor. She was put on bed rest. That baby was born at 40 weeks after those interventions were successful. Had she not gone in as quickly, as soon, had not been paying attention to baby's movement, there's no way to know if he would have stayed in utero for the full 40 weeks. We also believe that it's a way to identify fetal growth restrictions earlier. So usually babies that have experienced fetal growth restriction have basically warning signs, and the movement is one of those warning signs. And it's a slower demise for a baby that's lost to stillbirth because of this. It's usually not an instant event like a cord injury that can happen really quickly. And so we think that could be a warning sign that doctor then starts researching, looking into, and is able to track those that fetal growth restriction and intervene at the appropriate time to get baby here safely. We also know that women who have stillbirths are at substantially higher risk, like 4 to 5 times the risk of dying when delivering that stillborn baby. And so again, going back to mom and baby's health are intrinsically linked. They are not separate. And so we want to also be an answer for maternal morbidity. Let me give you an example. We have a Baby Save story out of the state of Ohio, Baby Save Rocco. So if you go to our website and go to our Baby Save page, you could read his story. Mom is a fourth-time mom, not a new mom. Mom is a nurse practitioner, very, very well informed individual, understands her body, understands her health, is getting all the intervention she needs and deserves as an expectant parent. She wakes up at the end of that pregnancy and notices that she's just feeling off. Can't identify that, thinks she's just having I'm at the end of my pregnancy, I'm tired, I have 3 small children, a full-time job. She happened to take that day off to get some things done before baby arrived, and noticed in that day that he wasn't moving his normal amount, that his movement was less than it normally was. She called her provider, and the provider had her come in and checked it out. What was causing baby's movement to change was actually a problem in mom's health. She had skyrocketing blood pressure. She had not identified that as a problem with herself. We know that mom was at risk. Mom could have had a stroke or other serious consequences because of this major blood pressure issue. But it was baby's movement that triggered her to be seen, not her own symptoms. And so again, just thinking about like the whole, right? Baby and mom are tied together and their health is as well. If you want to see more research, like I said, our website, www.counttthekicks.org, has a whole section on research. And here's a slide that has some additional research about movement in pregnancy. So let's talk about how you can implement Count the Kicks. Now, I have a wide variety of individuals here, everything from a nurse manager to a pediatrician to a Healthy Start worker. Wonderful that you're all here. And how this looks for implementation could be a little bit different based on your patients, your clientele, and how you serve them. So certainly, I'm going to give an overview of this, but try to think about your setting and how it would be best implemented there. So again, Count the Kicks is an evidence-based stillbirth prevention campaign. It's an early warning system. Baby's movement is oftentimes sometimes the first and only warning sign that a baby may give that it's in trouble. It educates women and expectant parents on tracking movement, gives them the tools to do that, and the education they need. It empowers them to speak up to their provider when they are concerned. This is important. And it may not even be a provider's fault that a mom's not willing to speak up. I think back to my pregnancies and I never wanted to be a bother. I never wanted to be an alarmist. And so it gives them the tools and the courage to have that conversation. 1 in 3 at-risk babies. That's what we're talking about doing today, saving those 1 in 3 at-risk babies. Why does movement matter? Movement is, like I mentioned, one very important way that a baby communicates before birth. A change in a baby's movement can be an early sign and sometimes only warning sign that a baby may give that it's in distress. Why does a baby's movement change when they are in distress? A baby is just like you and I. So they're a living human being. And so when they're not doing well and they're not feeling well, they conserve energy. Think about the last time you were ill. My daughter just unfortunately had a stomach virus. Very, very bad, like didn't feel well at all. She slowed way down. My very active gymnast became, someone who conserved energy by just laying in her bed. She slowed down. She felt weak, right? She was shaky, trying to go up the stairs or even walk to the bathroom. At the end of that experience was exhausting, something that she would not have thought of prior to that. So when baby is not feeling well, they will naturally conserve energy and they will put that blood flow to vital organs like the brain and heart. They will go into survival mode and that will change their movement. They will get weaker, they will get slower, and in some cases they may speed up. So let's talk about the 3 types of movement changes. Reduced fetal movement is the most common type of movement change that we see or that expectant parents may experience. That's when the baby slows down. They're conserving energy or they're being restricted by an umbilical cord or maybe not getting the blood supply from the placenta as they need to, etc. The second type is they feel weaker. So strength of baby's movement. And the third is a sudden and wild surge of movement. This also can be an important warning sign of distress. That particular warning sign needs to be examined very quickly. That usually means baby's in serious trouble and time is of the essence. And so those are the three types of movement changes. Since kicks matter, let's start counting. When should a mom start counting kicks? Based on evidence research, it says that babies really don't create a steady pattern until into that second trimester, close to the third trimester. So if you're at a high risk pregnancy, we recommend counting the kicks at 26 weeks. But for the rest of the population in non-high risk situations, we recommend 28 weeks gestation. And that is based on what research says, where baby develops or establishes a set pattern of movement, but also that the expectant parent can differentiate, can feel that pattern of movement. We know that the location of the placenta can be an issue for some moms. And so every mom may be a little bit different as to when she can feel that movement and can discern when that is established as a normal movement pattern. So 28 weeks is our recommendation. That's the beginning of the third trimester, 26 weeks for those high risk patients. Rolls, what is a kick? What do we count? Rolls, kicks, jabs, anything except for hiccups because they are involuntary. So when mom experiences movement, she might define it a little bit differently, but it's essentially all movements she can feel with the exception of hiccups. Some patients have asked, I've had expectant parents ask, like, how do I know if my baby has the hiccups, especially those first time moms? And so that is a conversation to have with them. As a woman who has had 3 babies, it became very clear to me when my baby had hiccups. It was a very rhythmic, almost, if you think about how our bodies have hiccups, it's a very rhythmic, almost spasmic action and feeling. And that is how baby displays it as well. So those are important conversations to have with your clients and patients, like talking about those rolls, those kicks, those jabs. Now, movement might feel different towards the end of pregnancy, but babies will move up to and even through birth because they're alive, they're living. And so it's important to remember to tell mom, even though it might feel different when babies are smaller in that beginning of that trimester, they may be doing flips and rolls where once baby is head down and ready for birth, it may be more like they stick a foot out the side or an elbow. You can really see those body parts, but baby will continue to move. How to count the kicks and be in tune with your baby and your body. So this is just a simple way. We recommend that you track your baby's movement with the free Count the Kicks app or the paper kick counting charts every single day. So we want to establish a healthy pattern where we count our baby's movements every day, preferably at the same time of day. Find a time when your baby's normally active and use that as a guide to count your kicks. We do encourage, if it's possible, for expectant parents to count the kicks in the evening. Recent research has shown that babies that are active in the evening tend to be healthy babies. And so if possible, but if not possible, please have them find one time each day that they notice that their baby's normally active, maybe after a meal or whatnot, and have them learn their baby's normal. How long does it take your baby to get to 10 movements is their normal? So it might take my baby to take my baby 10 minutes to get to 10 movements on average, and it might take your baby 30 minutes to get to 10 movements on average. Learning what's normal for your baby and then speaking up if you notice a change in that. So we just are encouraging expectant parents that if they have a concern here, it's time to speak up. A concerned parent, an anxious parent is not a healthy parent. We want to hear those concerns. So our free app, we've mentioned it several times. Let's talk about what it does. I encourage you, it's a rare occasion where someone will actually tell you to pull out your phone, but I encourage you, if you have not already downloaded the free Count the Kicks app, which is available in the Apple and Android stores, the Google Play stores, both, you are welcome to do that right now. Download that free app. Like I said, it is in 14 languages and more to come. We encourage you to play with this, learn about it, but just some of the features that you might want to know about. You can restart your kick counting session or delete a kick. You can set daily reminders to count the kicks. You can review your kick counting history. You can see the little footprint in the top corner where mom's tapping and it's tracking her time. It shows the chart there. Moms can count, or expectant parents can count for twins. They cannot count for triplets. So counting for twins is a little bit of a deal, especially in the beginning, as mom or expectant parent learns to identify which baby is moving. So this is a process that the individual carrying baby is going to have to go through to determine that. Usually twins, baby A, baby B, so to speak, can be, mom can learn to discern. But with triplets and beyond, that is not likely possible. So it is for twins or single births. You can track future pregnancies on the same profile. You can manage multiple devices. So an Apple iPad, an Apple Watch, an Apple phone. You can track movement on any of those. The Apple Watch is super handy because it's right there on your wrist. You just tap away. It's tied to your phone, so you can see your data there. So these are other features: strength tracking and notes feature. So not only are we encouraging them to learn their normal kicks, how long does it take your baby to get to 10 kicks? We are also at the end of a kick counting session asking the individual to discern the strength of that baby's movement. Did it feel light, kind of like those very early movements that an expectant parent might feel when baby just starts to move? Or is it fierce, that whole foot coming out the side of mom? Is it strong? They'll learn to discern. They'll be paying attention now. It's somewhat subjective, right? But they're going to pay attention to their baby's movement and know what feels normal, what is normal for their baby, and they're going to track that. They can even put notes. You can see here that said that baby felt strong like normal. And so that's, if they get interrupted 3 times, like, hey, this kick counting session was a little bit off, or I'm feeling sick today, they could put a note like, I'm feeling sick. And so I'm feeling off, baby's feeling off. So any kind of note they feel like they need to put in there, they're welcome to do. Other things that our app now has: video capability, educational tools for how to count the kicks, and videos. So if language is a barrier, at least there's a visual there. The other thing that I think is super important to recognize is that we know that there are many things that can impact birth outcomes and positive and healthy pregnancy experiences. So we have added a resource in the resource tab on the app. It's tied to our Healthy Birthday website, which of course is the nonprofit that runs the Count the Kicks campaign. And we know that if moms don't have access to good healthcare, right? If moms don't have access to healthy food or to safe housing, to transportation, to get to those care appointments, then that impacts their pregnancy experience. That can impact their stress levels, that can impact their health, it can impact baby's health. And so this resource is a really cool thing where you can put your zip code in and it will pull up programs that are available in the area. This is a living resource, so we can always add more resources. So if you go into the app, you put in your zip code and notice that an important community resource or your organization is not listed but should be, let us know. We can always add that to the list of resources available. And so yet again, trying to impact those social determinants of health, looking at pregnancy as a whole. So that's another important feature, I think, of our app. And it is being utilized by our app users now. And we are really excited about the potential to try to improve birth outcomes, not just through kick counting, but in all other ways as well. This is a great video. It shows you how to use the app. So I'm going to go ahead and play this. Enjoy, and make sure if you have any questions about using the app or about kick counting, that you ask those in the chat and I'll answer.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So with that app, one feature that I didn't highlight but was on the slide is the expectant parent can literally text or email their kick counting history to a doctor. And I think what's really important here, it helps providers, but it also helps parents. It helps parents communicate. It gives them real data to rely on to have that important conversation, but also to communicate it well so provider knows what's going on. It's a very different conversation when mom calls and says, I feel like my baby's movements have changed versus I know my baby's movements have changed because normally my baby takes 10 minutes to get to 10 movements. And today it took an hour and a half. Baby's strength of movement feels different. It's a very different way for that conversation to happen and something that a provider has tangible information to grab onto to delve into further. And so I think it's a resource. I know it's a resource that will help both mom and provider. So let's talk about integrating it into your practices. One thing that I want to highlight is that we know that stillbirth is a sad and heavy topic, but it is important. It is preventative medicine to have conversations about risk factors. I go to my provider for annual physicals, and she encourages me to get a mammogram, not because she wants me to be afraid of getting breast cancer, but she knows that preventative medicine matters. Kick counting is preventative medicine. Like that should be a standard of care. We also know that we talk to expectant women about all types of risk factors. We talk about the risk factor from miscarriage. We talk about if you don't take your folic acid or take your prenatal vitamins, that there could be consequences. We talk to them about all kinds of potential genetic issues and testing for Down syndrome. We explore all the possibilities. Stillbirth needs to be a part of this important conversation, not to scare moms, but so that they're aware that there's an importance to paying attention to movement, that stillbirth does exist. I work with a lot of women who have lost babies, and they are all angry that they did not realize how important movement was, but they didn't realize that stillbirth was something that was happening in 2022. And it absolutely is. And we need to talk about it. We need to not shy away from it. It is something that we can do something about, and we need to be doing that. So stillbirth just happens. There's nothing we can do. I hope by now in this presentation, you realize that there are warning signs and that there is preventable stillbirth and we can prevent that. And we need to be doing what we can to do that. This is really common from expectant moms too. Her baby is always active. It's not a concern. I have I've had women who've lost babies that said their babies were so active that they literally turned off their attention to that. They stopped paying attention to the baby's movement because baby was active all the time. They weren't having regular check-ins. And so they weren't aware when a change occurred or when baby stopped moving. It took them a while to recognize it because they had started to tune it out. So babies are active until they aren't. Some cord and placental issues can be quite sudden and need to be addressed quite suddenly. So it's important when mom is in tune with her baby, in tune with her body, and knows to speak up. She's almost at her due date. Actually, the risk of stillbirth increases as a mom approaches or exceeds her due date. So it's even more important towards the end of pregnancy. And so we want you to have this important conversation. Now, having it with moms that have experienced a loss, you need to go in and still have the conversation on movement. They obviously are aware at that point. Ignorance is gone, that stillbirth is something that could happen in a pregnancy, but you're still going to have that conversation. You're still going to educate. Make sure, these are some tips, to read the chart prior to entering the patient's room. When a provider comes into a room unprepared and asks questions and has them relive that hardest trauma, and it changes the approach, it changes the conversation. So make sure you know the patient in the room and their situation. Since women who have had a stillbirth are more likely to experience another stillbirth, they are considered high risk. So we want them to count their kicks at 26 weeks, beginning at 26 weeks. We also encourage you, working with the loss community, these individuals want to talk about that baby. They want to hear that baby's name. They want to acknowledge their experience. So it's important that you do the same for them, that you acknowledge this experience. You're empathetic. You avoid medical terminology like fetal demise. We know you care about your patients, and we know that you're doing the best you can. But these are tips that have actually been given to us by those that have lost babies. Then you need to ask if anyone has asked them or talked to them about the importance of tracking fetal movement. And this is the part where you have to be careful. We don't want to assign blame to that individual for the loss of their last baby if they weren't tracking movement, or they feel guilt unnecessarily over that loss. And so you want to have that conversation, but you want to have it gently and just make sure that they have the education if they had not already heard about that. Some common myths. This is really important. Research has debunked a lot of these ideas since our campaign started, and it continue. Like I said, we need to continue research. We need to continue learning. But these are some of the common myths I want to bring to your attention. I just talked about this. My baby is always active, so I don't need to count my kicks. We're not going to spend any more time on that, but we know that's false. Only those experiencing a high-risk pregnancy should pay attention to their baby's movement. Absolutely not. A lot of the women that we work with were not high risk. They had no risk factors for stillbirth until they lost a baby and became high risk. All expectant women should be educated on count the kicks and knowing their baby's normal. And this is a big one, and this is outdated information. My baby should get 10 kicks in 2 hours. That's actually false. Every baby is different, and the recommendation is to expect 10 kicks in 2 hours is actually outdated. Current research indicates that moms should know what their baby's normal amount of time each day it takes to get to 10 movements is. And so we've actually got studies on assigning time to movement and how dangerous that can be. So if a baby normally takes 10 minutes to get to 10 movements and they take 1 hour and 58 minutes, it's still within that 10 and 2. Mom may not speak up. We just received a story just like this where mom spoke up. Provider said babies moved 10 movements in 2 hours. Baby did not survive. And in that scenario, no finger pointing here, just making sure that we understand that every baby, every pregnancy is different, that research has moved away from 10 and 2. I can just use a Doppler device to monitor my baby's well-being. False. Actually, Doppler devices bought on the internet have all varying capabilities, and mom also is not trained to use a Doppler and maybe actually hearing her own heartbeat instead of baby's heartbeat and getting a false sense that all is well. So a baby's heartbeat is actually one of the last warning signs, one of the last things that occurs when baby's in distress. When heartbeat is being impacted, baby's in real trouble, where movement can be an early warning sign, and intervention may be able to be taken to help baby either stay or get here safely. If baby isn't moving, I should drink cold water or eat something sugary to get baby moving. False. This is just like fooling any other blood test or any other thing that we do. We want to know what baby's normal is. Research has moved away from the idea that we're to instigate movement. We want baby to move as they normally do. And if they are not, we want parents to speak up about that. The worst thing that could happen here is that the pregnant person speaks up, the provider checks the situation out, and baby's fine. That's great. That is best case scenario. Worst case scenario is we don't get a normal movement pattern, we don't speak up, and baby doesn't get here. Babies kick less near the end of pregnancy. This is a big no. Babies do not run out of room at the end of pregnancy. I mentioned this earlier, how it feels, the types of movements may change, maybe more jabs and fewer rolls, but babies are living. They will move up to and during and through labor and birth. Triage, labor and delivery, if there are any labor and delivery nurses out there today, doesn't need Count the Kicks education. Actually, it's the perfect place for Count the Kicks education because you're seeing the individuals with concerns and you're discharging those individuals, right? If they don't stay in the hospital to have baby or there's not an immediate issue to address, you are discharging expectant parents. Make sure you discharge them with this, arm them with this information. It may prevent them from unnecessarily coming back to labor and delivery triage, or it may get them to come back with a concern. We also don't want to use those ultrasounds as though they are something that can live on for 5 or 6 days. Baby was okay yesterday on ultrasound. Doesn't mean that something hasn't changed in baby or mom's health in the interim. So if they notice a change in movement, even if they've just had an ultrasound, they need to speak up. Pregnant people should avoid dental care. False. We are actually working with Delta Dental and other organizations on this. Moms are at risk of more issues during pregnancy, higher rates of gingivitis and disease and decay. While pregnant, they actually, babies are also forming their own oral health. So it is important that expectant parents get their screenings done, that they are seeing dentists, because that will impact their overall health and their pregnancy health and potentially their baby's health. So what do you need to remember? Remember, stress the importance of knowing their baby's normal and speaking up. You can send a brochure. We have free Count the Kicks materials, which I'm going to mention in the free resources section. You can send a brochure or an app card reminder home with mom. Share with mom that research shows evening is usually the best time to count the kicks. I mentioned that. We still want them counting once a day. If they work the night shift, this isn't something they can accomplish. We still want them counting, but ideally in the evening. Tell mom that providers should be asking about baby. So this is kind of holding all of us accountable, right? Every appointment in that 3rd trimester, you need to think about not asking yes or no questions. So you want to ask open-ended questions. You want to continue this conversation, make sure you're learning what mom's aware of and what mom's not aware of. So tell me about your baby's movement. How is tracking your movement going? Can you show me your Count the Kicks graph on your phone? What questions do you have about your baby's movement? Really engaging a conversation. Is your baby moving? Is a yes or no question. And I've had women who have lost babies say, my doctor asked if my baby was moving. And I said, yes, because my baby was moving. But what I did not know is my baby wasn't moving normally for themselves. Or what I did not know is how to communicate that change in movement. And so it's really important to have this conversation at every appointment in the 3rd trimester. If you're only working with patients or clients in certain parts of their pregnancy, then identify ways to have this conversation throughout the process, maybe an intake time. Maybe it's you see them at glucose testing, whatever it is. So other ways to integrate, add to discharge paperwork, add Count the Kicks there, have all of your front desk trained. Anyone that's answering questions or going to get a patient to a nurse or a provider needs to know how important it is for that transition to happen quickly and for direct communication to happen, not it's going to be 4 hours before they get a call back. Include in family care or intake forms if you have those. Glucose testing is the perfect time to have the patient download the app while they're waiting for those results or have that conversation. Can you include this in your emergency medical records, your EMRs, your EHRs, asking so that there's a queue to ask that question? Add Count the Kicks to the phone recording for patients when placed on hold. So when I've been placed on hold, there are several messages that my provider's office puts through that pre-recorded wait time, and Count the Kicks could be a perfect, that could be a perfect place to make sure that moms know to count their kicks in the 3rd trimester. We are trialing or piloting a form where this is handed to all expectant people at their 3rd trimester appointments. And they're asked to fill it out, to have that conversation. There's a tear off for them to take home. Notice it's asking them to think about, if they have a concern, how would they contact their provider? It's an important conversation. It's really life-changing when a provider or a support person tells an expectant parent that they want to hear from them and how they can hear from them. That changes that conversation. It opens that door, and it will prevent that mom who doesn't want to be a burden. It will prevent her from talking herself out of that phone call. And so opening the door to, how do you call me? How does this process work? We want to hear from you when you have a concern, is a vital part of the conversation that needs to happen. We just talked about this, so I won't spend a lot of time on it. But it's important to think about the systems that you have and how this could be integrated from top to bottom throughout your entire system. And we just have a great picture of Baby Save Margot out of Cincinnati, Ohio. And I love that picture. She is now an active 14-month-old. And so we're just thrilled with Margot's arrival. After visit summaries, this is an example of a gold standard after visit summary, as we would call it. Notice that they've included Count the Kicks in that after visit summary. An example of an intake form, we have a great partnership with Celebrate One in Columbus, Ohio, and they only have one time where they can get this information to their clients. They have one contact, and so they included it in their intake form so that they made sure that this information was shared. Additional resources. I said, hey, this is exciting. There are free resources for you, lots and lots of them, thanks to this partnership with the Florida Department of Health. We're so grateful for them and for great partners like Casey Omecki there at the Department of Health that partners with us to get this information out in your state, is sponsoring this webinar today. In fact, I would love nothing more. And if you would like to get a free Amazon card, this is your time to do it. For you to go onto our website, www.counttthekicks.org, use this QR code to order the free educational materials for your office or to hand to your clients today. We have promo posters in English and Spanish, how-to posters in English and Spanish, and Haitian Creole, brochures as well in those languages, and they are 100% free. Again, if you'd like to be entered into that drawing to receive an Amazon gift card, you need to order those materials during this presentation or shortly after, in the 15 minutes following it. So we encourage you to get those. Put them up on bulletin boards, put them on bathroom walls, clinic walls, in libraries, wherever this information can intersect with expectant parents. These posters can be hung, these brochures can be handed out. App card reminders are business card size and easily handed out to clients in packages or just to carry it with you wherever you go. So I'm going to hit this happy music. I'm going to play that right now. I think it will play for us. And we're going to give you an opportunity to order these free materials that have been funded by the Florida Department of Health and their partnership. And we're just excited to offer those to you today. I don't think I'm going to have any happy music play. I don't see a live button. So I just encourage you to go to www.counttthekicks.org, go to the order materials tab, and go to the state of Florida, click on the state of Florida, and there are a buffet of free choices, no cost for shipping, no cost for materials, no cost barriers at all for you to be able to do that. So I'm going to give you just another minute here. I'm going to look in the chat. I've seen a couple of questions. So while you're ordering your materials, I'm going to look at those questions. Awesome. Oh, you ordered some yesterday. You can still be in the drawing. Mary, I will add you to the list for the drawing. Thank you for saying that. Do we have a social media kit available? I actually, Mary, if you want, or Jill, I'm sorry, if you want to email me at, and I'll have that email at the end of the presentation, and I'll also include it in the post presentation email I'm sending to everyone who's attended and or registered. Please contact me. Yes, I can get you some social media items to share on your social media channels. Great questions. And I'm going back to look at one more chat while you're working on ordering. Hopefully that's going well for you. Do we have access to videos and the presentation? So yes, I will be emailing this out afterwards. The other place you can go for amazing videos, and I'm not sure that's listed in the free resources section, so I'll just mention it here. We have an amazing YouTube channel, and it's videos that you can grab to educate your patients or clients. And so if you go to our website, there are a buffet of choices. I'm going to talk about those here in a minute. Thank you for promoting Count the Kicks. We are thrilled. Thank you, Anastasia. I'm just going to write Anastasia's email down while you're ordering your materials. Again, if you order materials now or within the first 15 minutes after this presentation, if you're like me, I don't like to do too many things at once. You're welcome to do it at the end, but would love to see every single one of you order materials today. Okay. In the interest of time, since we are at that 12 o'clock hour, I'm going to go ahead and move forward to the other free resources. Thanks to those that have ordered materials. Another thing available to you with a free code, Save Babies Florida, is the continuing education training that we have available on Count the Kicks, where you can get, it's a 90-minute training for 1.5 CE credits, I believe. Other free resources, go to our website. We have great resources, the Count the Kicks Academies for parents and providers. And those kick counting charts are available in the 3 languages mentioned. And of course, those videos. And why are we doing this? Right there. Those are all babies that have been saved because their parents were educated to track movement, speak up when they notice a change. Providers did all they could to get them here safely. And we are just thrilled to see those faces. This is the impact of our work. I will send this video with the presentation, but we won't be watching it today. So for next steps, familiarize yourself with the Count the Kicks app, practice, 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 order those materials. And if you are in an office setting, who's going to order those materials? Designate someone to oversee that office supply and to make sure you never run out, that you're utilizing those. Take 3 to 5 minutes with your patient to educate, educate, educate. Knowledge is power. You are a tool of education by sharing this. And so make sure you're talking about kick counting with open-ended questions at every appointment in the 3rd trimester, every single appointment. Remember, the risk of stillbirth actually increases towards the end of pregnancy. So important. Make sure your entire staff knows about the campaign and the importance of tracking fetal movement. Make sure nobody gets put in a call queue and are being called back 4 hours later if they have a movement concern. Encourage any expectant parents you work with. Labor and delivery is open 24 hours a day. Go to the hospital. They're there to serve you 7 days a week. We encourage anyone who has a concern, a real concern, needs to be addressed. Use those systems changes, those electronic health forms, intake forms. Look, where can you integrate this throughout your own system? And remember, hours and minutes matter in preventing stillbirth. Thank you so much for joining us. There are other ways that you can connect with us. Our social media channels are listed here. You can sign up for our newsletter to stay in touch with us. We want to invite you to the State of Black Maternal Health. It's a webinar that we are hosting with people around the country and talking about during Black Maternal Health Week. We're talking about it. We're talking about those disparities. We're talking about what we can do together. We want to make sure that we're not marginalizing people, but we're reaching those that are being marginalized. So please register for that webinar, and just by going to bit.ly/BMHW_SO BMH. So that will also be sent in an email so that you make sure that you have access to that. I think it'll be really impactful and important presentation. And finally, let's save babies together. Thank you for your time. Thank you for your passion. Thank you for the good work you're doing in your state. You are all amazing partners, and we are just thrilled that you joined us today. I hope this presentation gave you what you were expecting and what you needed to take Count the Kicks and run with it in your area. We are here as a resource. There's never a time that we aren't willing to help or assist. So if you have ideas, questions, any concerns, we want to hear those. We want to have those important conversations with you. So if there are further questions, would you please drop those in the chat? I would be glad to answer them now. We are so thankful for each one of you. And I'm just going to write down who's also ordered. So thank you for doing that ordering. We hope you get those materials quickly. You should get those. If you do not get those in 7 to 10 days and probably closer to 5, please do let us know if you have any concerns. We have a great fulfillment center helping us and partnering with us. Any last minute questions? I'd be glad to answer those. I am done with the presentation for now, but I'm going to go back and make sure that you have access to the last slide in case you're able to join us for that State of Black Maternal Health being hosted by our Health Equity Director in partnership with other important individuals across this country. So please check it out. Again, would love to have any questions dropped in the chat if you have them. I'd be glad to answer them. If not, I'm going to go ahead and let you go on to your busy days. We know that you are doing great work in Florida. Thank you again. Thank you to the Florida Department of Health for your partnership, and to Casey Omecki specifically. We are thrilled to have been given this opportunity to share Count the Kicks. All right.